Okay, so this will be a video on oral cares for intubated patients. We do oral cares for these patients to help reduce the likelihood of them getting VAP or ventilator-acquired pneumonia. So we're going to do oral cares on these patients about every 2 hours. So what you need to do is knock, introduce yourself, wash your hands, check your patient's vital signs, and also check out that ET tube for any damage. And then the first thing that you're going to do is make sure you're wearing gloves and the appropriate PPE. And then we'll go ahead and get started with our patient. So this little piece, it kind of is universally attaches to all of the pieces. So this end is going to attach to suction, and the suction will be set at -100 to -120. And then it has the on and off switch for the suction. So the first thing that we'll do is we'll attach this suction. It has this nice little kind of like a sheath, and you'll be able to get inside the patient's mouth, suction the mouth, get anything that's kind of been like sitting in the mouth. We'll go ahead and get that all suctioned out for that patient, and then you just want to make sure that you are covering it up so it's not like laying on the surface and becoming contaminated. So then after you get that all suctioned out, then there's a piece, it's like a toothbrush piece. I don't have that in my kit, but what you're going to do is you're going to attach the toothbrush piece, and you're going to dip it in this sort of like toothpaste type of solution. And then what you're going to do is you're going to brush this patient's teeth. So you want to make sure that you're brushing the inside and the outside. You want to make sure that you're brushing the top of the teeth, the bottom of the teeth, all the sides of the teeth. You want to make sure you're getting back to the molars and the teeth at the front of the mouth. And you want to make sure that you're being gentle with your patient, but you don't want to be too gentle, otherwise you're not getting their mouth clean. So you kind of need to find that happy medium between gentle and a little bit more firm, so that you are getting that mouth as clean as you can. So once you brush the teeth, then you're going to go ahead and turn on the suction. You'll suction all of that stuff out of the mouth. When you do that, the next thing you're going to do is you're going to use this sort of like foam, this little foam piece, and you're going to apply this moisturizer onto the foam, and then you're going to make sure you moisturize the mouth. You want to get the cheeks, the roof of the mouth, the tongue, the gums, and also the lips. You want to make sure that you have that patient's mouth nice and moisturized. So then the next thing that we're going to do after the next 2 hours is up and it's time to come back for oral cares is we're going to use this suction. So the suction catheter also hooks on. You still have the on and off. This is still attached to suction. This is going to allow us to get a little bit farther back into that patient's kind of like their throat area. With patients that are on the ventilator, they aren't able to cough up any of those secretions. So by doing this, we're going to be able to get those secretions up and out for those patients. It does also have that little sort of like Murphy's eye, just in case it gets occluded, at the end of the suction catheter. So then the next time you come in, we're going to use this foam tip brush. It also has suction, you can kind of see at the end. So this works very similarly to the toothbrush. So you're going to come in, you're going to dip this into this solution, and again you're going to kind of brush the cheeks, the gums, the sides of the mouth. You want to get the roof of the mouth, the tongue, along the gum line. You want to get all surfaces of the mouth. So you're going to use this to help clean the inside of the mouth, and again that's going to help make it less likely that your patient will develop that ventilator-acquired pneumonia. So after you've done this cleaning as well, then you're going to again moisturize that patient's mouth. You want to make sure that it's the cheeks, the lips, the roof of the mouth, the tongue, the gums, and the lips, so that the patient has a nice moisturized mouth. When you are doing these cares, it's a good time for you to check for the integrity of the skin by the ET tube to make sure there isn't any breakdown. And it's also a good opportunity for you to look at the condition of the ET tube to make sure that there isn't any damage.